My name is Brian O'Connor from the ECHAlliance, the Global Health Connector. Today is about explaining what we keep talking about, which is UNGA. Now, for many of you, you will know it. I promise you, having talked to a number of you, you don't know what that means. So I'm pleased today to have with us our partner, Declan Kirrane, from the Managing Director of the ISC Intelligence. Declan, could you just take us through what UNGA stands for and what it means? And then we'll get on to more detail later.
Certainly, Brian. Great to see you again. No, you're right. We have to improve understanding of the UN system. The United Nations General Assembly, otherwise known as UNGA, takes place annually, and this year the meeting in September, the General Assembly in September, will be the 79th version of UNGA, the UN General Assembly. And this is, if you like, the annual general meeting of the United Nations. This is the body, and many of you will be familiar with seeing presidents from around the world speak from the General Assembly in New York. They give a set piece speech on how they see the world, and that takes place during the General Assembly. In fact, during what's called the High Level Week. So the General Assembly manages the business of the United Nations. As I said, I compare it to an annual general meeting of a corporation or other organization, and then they set the program, they set the agenda. And this is hugely important because the United Nations is the only global platform that exists, partly, and we'll talk more in a second, partly why we're there, of course, is to be part of that process, inform that process, feed into that process, and help the policymakers congregating at that meeting do their job. And their job, of course, as they get up in the morning, they look out the window and they want to make the world a better place. They want to address common challenges, global challenges, which you will know as another acronym, the SDGs, the Sustainable Development Goals. And these were put in place in 2015. And then for the very aware of you out there, you will know they followed the Millennium Development Goals, which, as the name would suggest, were launched in 2000. So now we're into the second tranche of these goals, objectives, and we'll certainly soon be looking at what the next round looks like. So the UN primarily focuses on the SDGs and their implementation, and that'll begin on the 10th of September. And we're looking forward to being there with Brian and many other partners. And Brian will just maybe introduce what we'll be doing there, and then I'll come back to you with more detail on that. Thank you, Brian.
Thanks very much indeed, Declan. That I think is very helpful. Within that, we did this last year with your partnership with yourself. We had the scientific sessions. Do you want to explain what part that plays in the overall picture you've painted?
Absolutely, and what the meeting we will convene together is the Science Summit at the United Nations General Assembly. And we have a very simple objective there, and that is to raise awareness of the contribution of collaborative research and development, collaborative science to the United Nations SDGs. So when we talk about alleviating poverty and hunger, addressing global health challenges in the area of climate and the environment, I think everyone can agree that science plays a role. So what we want to do is articulate that role, bring stakeholders together to inform that decision-making process. So at the General Assembly, when the representatives of 192 member states sit down to cogitate and reflect on what they're going to do, we want to make sure they've got evidence at hand, which helps them solve the problem. And part of that is going to be an increased understanding of the contribution science plays. And we cover a range of topics, but of course, with ECHAlliance and other partners, we will have a very, very strong focus on health through the meetings Brian will bring together. And he'll talk now about what that looks like, and then I'll come back and give you some detail on that. So a very, very important juncture, and this is the largest meeting of its size, and we're collaborating with many UN agencies and stakeholders from around the world to build a stronger awareness, and through that awareness, create recommendations and work with the United Nations agencies to implement. United Nations comes up with these wonderful ideas and recommendations, and we want to work with them in a range of areas to implement those ideas and working with stakeholders on the ground. And that's why the alliance bit of the ECHAlliance is so important, because these alliances are wonderful. They're very vigorous. They're composed of local stakeholders. They're composed of citizens in many what we might think are far-flung places. But of course, those far-flung places are where people are really being impacted by diverse challenges, and these are really what the SDGs are designed to approach. So health, absolutely central there. Thank you, Brian.
Well, it's interesting. First of all, we've got rid of 2 acronyms, because everybody talks in acronyms these days. So we've now got UNGA, which you understand, United Nations General Assembly, the SDGs, and now we're moving on to the whole question of the sessions. Our objective, as you know, is the ECHAlliance, because we bring together research institutes, we bring together hospital systems, health systems, governments, patient groups, industry, etc., etc. By bringing them all under this neutral umbrella, which we've created over the last, 11 years it is now, through the Global Health Connector, it is important that we have a voice on the world stage. And as a result, we selected about a year ago our 4 priorities, which are healthy aging, to focus on that. We talked about green health, which is how we as a sector affect climate. And as someone said recently, if you added up the carbon issue within our own sector, we'd be the 5th largest polluter in the world. And then you move on to women's health, which of course is a very hot topic and should be, right? And then we move to data and digital. And of course, that applies to all of our Global Health Connector around the world. So in that vein, the advantage we found last year, Declan, and you were instrumental in this, was to literally, as we always do, connect dots. So we have a lot of dots of our own, but to be able also to bring in UN and other bodies for us to listen to them, and then to input into their thinking, to influence the next couple of resolutions or whatever it may be, is crucially important. Do you feel that you can really have an input, an impact, maybe is a better word, given the number of subjects going on with 190 countries? Do you think you can really impact the thinking of the officials?
Absolutely. And this is becoming more important. Simply put, ECHAlliance connects the UN to citizens and their health concerns and activities. That's absolutely, no one else does that. So therefore, that's a two-way street. You're providing input to the UN, and the UN then is using you as a channel to address challenges. So I think that's a very, very symbiotic relationship, and a hugely, hugely important relationship. When we break that down into the various themes that you've mentioned, then we see huge opportunity for building research alliances and research collaborations that can further advance innovation in the healthcare sector. And of course, we need to find new solutions to big, big, big problems. And this is only going to happen if we work at global level. And of course, everyone's, I think everyone's tuned into the global idea, but, global is difficult. Global is not easy for many reasons. One is because we have a wealth of regulations that really aren't global, that promote national interests, you see. And if, these national interests are primarily national interests of developed nations, and they have a tendency, and this is, accepted, it's very benign, but the impact of their tendency to regulate has many impacts on collaborations with less developed nations. One, I suppose, very topical example of this at the moment is artificial intelligence. As we will be aware, the European Union has adopted a regulation on artificial intelligence, and this is going to impact our collaborations with many less developed nations, in particular, in many areas, but in particular in the area of health and health research, because the artificial intelligence regulation, it's going to do a number of things, but essentially what it's going to do is it's going to regulate the access to data by various stakeholders, including in less developed nations. And when I say less developed nations, I remember there are many of those. On the back of an envelope, I think we've got about 20, just under 30 OECD countries. I don't know the exact figure. I think it might be 31 or something, but just let's call it 30. The rest really come under the lower middle income country rubric. So that's a lot of nations. It's a lot of people. and hugely, hugely important. And a key theme that came through very strongly at the meetings last year was the theme of inclusion. So inclusion means data inclusion and improving access. And in delivering healthcare globally, it's going to be data enabled. So we need to see, well, how can we enable this data to flow so that we can make people's lives better?
Yeah. Thanks very much, Declan. I think we're running out of time, but just to sum up, we, the ECHAlliance, are again going to be in New York on the 17th, 18th of September in the high-level week. We're currently creating our agenda, and almost too many things we want on the agenda, but we'll manage very well. And there, Declan and his team will support us on that. From this conversation, I'm satisfied, and I hope our members will be as well, and our audience, that we can have an impact on big decisions globally. And if you don't speak up, no one can hear you anyway. So we want to be heard. So over the next little while, you will see the registration coming out, the details of what you can do for our in-person and our virtual attendance meetings during those couple of days in New York. Those are our days, but of course we'll be there for quite a lot longer during that time as well. So look, Declan, I think we need to leave it there, if that's okay. And just to say thanks very much. There'll be many more of these. The education bit about getting rid of some of the acronyms was a big help. So thank you very much indeed. Thank you.
Thank you, Brian. Thank you.